So good afternoon from New Orleans. We're at STS 20, and my name is Lisa DeGarmo. I'm from UTHealth McGovern Medical School in Houston, Texas, and I have the honor and pleasure today to lead one of our roundtable talks for advanced practice providers. So our goal today is straight talk with APPs, current topics that we have in the APP community and in practice. And today I'm going to introduce our panel. Our first speaker is Jill Engel. She is Associate Vice President at Duke University in Durham, North Carolina. Our next panelist is Laura Wieste. She is at Memorial Hermann Health System in Houston, Texas. And our last speaker here is Julie Schafsthal. She is a PA at Emory Healthcare in Atlanta, Georgia. So our goals today, our objectives are just for introducing you to the needs of APPs. And as we have quality healthcare continues to grow, one of the solutions over the past 20 years has been the growth of APPs in the medical field. And today we just wanted to discuss about having APPs in cardiothoracic surgery and how we can be represented and continue to grow and to help support programs nationally like STS. And also how we can promote APPs nationally to ensure that we're building quality programs for our hospital and as a profession. So one of the things I wanted to talk with you, Jill, is that one size doesn't fit all for each cardiovascular program across the country. And if your surgeon is coming to a new program or you're building a new tower or a new heart and vascular institute, how can health systems assess their programs? And how can we help to maximize evidence-based practice and quality care?
So Lisa, that's a great question. I think one of the most important things that we could teach people is how to look at really a structured way to evaluate what your needs are. I think it's really important in the healthcare climate we are today to make sure everyone practices at top of scope. So there may be a lot of requests for APPs, being NPs and PAs, and we definitely want them in there doing the jobs that they're suited to do, but I think it's important to make sure they're practicing at top of scope and that the request is the right request for an advanced practice provider. And then determining what is the programmatic need, what type of patients do you have, who are the other multidisciplinary team members supporting that person to decide really how to set them up for success. So I think it really goes back to what's the structure, the process to onboard, support, and train these individuals and help them understand. They come with a lot of great tools, but depending on years of experience, you discussed evidence-based practice. I think it's on us to help professionally develop. And again, it goes back to having a structure and process to onboard, professionally develop them, and also use technology. You can hardwire a lot of the evidence-based practice today with your EMRs, whether it's your standardized order sets, your best practice alerts, your standardized templates, so that you really standardize across the CSU, but make it easier for the new providers. But I think a needs assessment is really the first place. And thinking ahead, you mentioned new towers. If you're going to grow a new program, grow a new tower, really important to get started because we know that interviewing and onboarding process takes time. If you have 3 months to hire, 3 months to credential, and then a training period, you really have to start about a year in advance to actively engage and begin the hiring process.
That's great. Thank you, Jill. And as you had mentioned, the onboarding process that we have for APPs and starting to build those programs. Laura, what is one of the things that you look for in your institution and for your program when hiring APPs? What are kind of the top hiring points that you have?
Right. Thanks, Lisa. So as you were saying earlier, that not, one size doesn't fit all. Mm-hmm. And so we have different size programs. In our program, our APPs follow the patient from the time they hit the emergency room or the cath lab until through surgery, through the intensive care, to telemetry and then home. And then we follow up with them as an outpatient as well. So what I'm looking for specifically in my area is someone with obviously a strong CV background, someone that has a team spirit and they're willing to function and participate at different levels on the team. Not everybody's going to be in the ICU every day, and so you have to be willing to change your hat and your role some days. I'm looking for someone that is a receptive learner, mm-hmm. as well as someone that's willing to share their knowledge and build our team. We also are looking for people with great communication skills, because you have to be able to navigate not just working with the surgeons, but working with the consulting physicians, our cardiology partners, our pulmonologists, people that are able to facilitate the program and growth.
Thank you. And to talk about communication too, what are some of the examples when having, it's so important for APPs to be the voice on the unit and with the service line, for communication with our patients and our physicians? How can we have great physician champions? How can we help to develop that communication between physicians? Jill, do you have any experience from your institution?
Sure. So I think the first thing we're going to go back to again is educate. If we have new providers we're working with, new physicians who haven't had a lot of experience working with advanced practice providers, it's our job to go introduce what the role is, how do we optimize the role, and really have a shared vision around what can that role do in the service line or in the particular practice. So I think going and also finding out who really is the leader of the group, especially if you're new, bringing in providers who can help you administratively, operationally, and how do you connect. So I think if you find that individual, for me it was the chief of CT surgery, and we had a dream to grow the team and really end up and had a 10-year plan, and it's really having a shared vision, a shared strategy, and partnering all the way through to figure out how to do that. And it doesn't take long. I think most of you who've been in practice a while, we've had these conversations after you get the APPs up and running and people see really what they bring to the quality of care, to the patients, to the service line. You really don't have to do a lot of promoting because everyone wants to get more APPs on the team. But it's really up to us to educate and do this the right way.
I agree. We have a lot of great physician champions that know the value of APPs and what they provide to the service line and to the program itself. So I know that our physician on our campus, Laura, works with him as well. He's a great physician champion for us, wants us to be out there and promoting our service line too, and works well with all of our referring physicians. And another big topic that we have is the bedside. What we have, the care at the bedside, nurses are changing. We have a lot of turnover at the bedside, but there's also a lot of turnover with APPs and staff too, whether people are going back to school and APPs in general having burnout and turnover. Julie, I wonder if you can kind of discuss at your campus and at Emory how you can prevent that and help with retention to stay having APPs, nurse practitioners, PAs to stay in the same institution and be there so that they can still provide the same quality care.
Yeah, I think that's something a lot of programs are, dealing with right now. You spend all this time training people, getting people oriented, developing a program, and you want those people to stay. So Emory's done a lot recently to try to retain. They hire new, they spend a year until somebody's actually fully functional as far as EVH, et cetera. And so, it's important that they want to stay. And so they've really worked on creating more of, I guess, a work-life balance. Mm-hmm. And so one of the things that they've done is, we have to take call. We come in maybe at noon on our call day, leave, able to leave at noon the next call day, certain things so that you're not at work 16 hours a day, every day of the week, and that, create an environment that people want to come to work and want to do a good job, et cetera. So Emory's done a couple of things to make, and then the physicians to make you want to be at work, and that, prevents burnout there as well. So I think a lot of places are kind of dealing with that situation. So they've done a couple of other things, just to make, encourage us to take our PTO when we have it. Mm-hmm. They're not telling you, you need to be at work every day. They want you to enjoy your life outside of work, because if you enjoy your side, that, then you come to work and you have a better attitude and you want to do a little bit more. So.
Thank you for mentioning that. I know that they had talked about that at STS as well. Laura, what can you attest to at your institution, whether it be as far as ongoing education or other areas that you can help to prevent burnout? Right.
So I was going to add that our institution sponsored me to come here to STS, and we're very proactive in making sure that the advanced practice providers are continuing their education, that we're meeting our yearly competencies, that we have opportunities to maintain the correct number of different procedures, that we're prepared for renewing our license and certifications. So I think that they're very supportive in that. I think that we have physician champions that support us clinically, and I also think that we have nursing administration supporting us as nurses, for nurse practitioners, making sure that we feel comfortable working alongside our physician partners and are working, I think, to the highest level of our nursing license as well as our advanced practice certification.
Thank you. Thank you. I know that at our institution as well, some of the things that are continuing to go through is just recognition. So really trying to make sure that the advanced practice are on the websites, that they're making sure that they're on the doors and facilities and that they're a part of the team. I think that's a big approach too, is that they're part of a team and they work and collaborate together. And kind of being here at STS, I know that I've already been introduced by our executive faculty to go back and talk about what we've learned here. So I think that's a big part of helping to prevent burnout and making sure that the APPs are well involved and really feel like a team player in their institution.
Right, I can add something to that. In our facility, we've just opened a structural heart program with TAVR. And so we've partnered with our cardiology, the champions of the TAVR program, and they've created a flyer to put in their doctor's offices to give to the patients that have pictures of all of the the key players, and they've put the advanced practice providers on the flyer, which I think really speaks to our team spirit, and that's something we're very proud of at our hospital, is that all for one for all, we rise together, fall together, and it's nice that the physicians came up with that idea.
That is. And Jill, and how do you get administration to really buy in to supporting your program? Because we know that it takes structure. It takes a lot more as you're starting to build. When you're starting a new program, if you have physicians coming in, you really want to build your program, not only with patients, surgeons, physicians, but all that multidisciplinary team that really comes together. How do you have that support with administration on the advanced practice side?
So, that's a great question, Lisa. So I think one thing is by promoting and having APPs move into leadership roles, that provides more understanding of what the role is at the administrative level. I think you have to be a partner, right? And so you have to go again, you educate about what you do. I think you have to learn a little bit about budget cycles and try to understand how to anticipate your requests, how to make sure you have the information they need, not only financial data, but you have to be prepared to provide quality, throughput data, patient sat data, other things that really help to justify positions when you go for position control. So it's really a good idea to go and get to know your business and finance team, to get to know your senior leadership team a little bit better, and if they're not familiar with what your role is, I like to take them up to the clinical space and really get to see the care that actually APPs are involved in, what they're impacting, and make sure that we partner and that we don't give them a big surprise. And they know when we come, I sort of have a standardized template and approach, and I look at quality metrics, I look at outcome metrics, regulatory. You always have to look at the financial piece, you look at work culture and patient sat, and you really deliver a nice package when you're going to go forward with a nice request. And I try to make sure I bundle that request, I do it all at once, and I don't go back multiple times. So I want to have a really good plan when I go in and make sure that I've answered their questions. So I see them as really tremendous partners at our organization.
Thank you. Thank you. I think a big part of just being in a forum like this, where you're getting to see how other programs are represented nationally, how if you're a small institution, seeing how a big institution is, and depending on how many pump cases you have, it really helps to see what's the support like at other systems. So I think it's a big thing to coming here and having other people going and viewing other systems and how does it work there, and see how if you can implement that model at your own facility too. Thank you so much. Laura, in an ideal world, how do you support your APPs to have the best program?
So in supporting the APPs, I think first we have to support ourselves, right? And so as leaders, I think oftentimes we take everyone under our wing, and sometimes we take it on the chin for everyone. And I think that we have to be able to support ourselves by coming to meetings, by making sure that we carve out time, obviously for family, but making sure that we're meeting our own needs. And then, with doing that, we can support everyone else. And so as the lead or the directors, to to support the other APPs, we have to treat them first professionally and respectfully. We need to value what they bring to the table. Everybody brings something different and at different levels. Some people may have years of experience, others may be new grads with new information that maybe some of the older APPs aren't privy to. Mm-hmm. So I think we need to respect them for what they bring to the table. I think clinically, we have to be able to be their resource. And so oftentimes, we have to help them plot out what they're going to do for the day or how the patient care is going to go until they build that kind of toolbox for themselves. I think it's important. One of the things we have on our service, it's kind of a little motto we have, and I'm sure a lot of people do, is that we say family first. And so you have to be able to, sometimes you have to go to your kid's cupcake party, or you have to be able to take the kid to the doctor or whatever. So we support each other, we cover for each other so that each of us can take some time off to do that. Obviously, when you're away at a meeting, somebody has to cover for you. And so I think we really adopt a team approach to support each other as people. Mm-hmm. Clinically, obviously, we have to be able to rely on our physicians to help with that. So we meet with them monthly and go over a few patients to make sure that we're meeting the board requirements. We also have yearly evaluations where we make sure that everyone is on track and that they're progressing and that they continue to learn. And then, as our program grows, we're trying to make sure that we have enough APPs that we're not overstressing people. And so some of the things you were saying, Jill, about coming to the table with all of your information, we're kind of working through that right now, and we're on the learning curve, and I'm so glad I got to talk to you about some of this stuff. But one of the things we've come up with is, from a budgetary component, is determining what we think the needs will be, and then how are we going to determine what our needs are going to be. So if you're starting a new program, I think one of the ideas we had was creating a CDM where you can track how many visits you have with a patient and put a number of minutes you spent with the patient. It's not a billable charge, but it is a charge you can go back and look at. And you can look at what you expect you're going to need and what you actually need. And I think it's kind of a helpful tool in trying to decide, do we have enough APPs so that everybody feels like they're making a difference, but they're not overworked.
I agree with that, being supported.
Yep.
I really liked also a continuing education. I think that's a big portion of it, to make them feel like they have the resources that they need, and then actually kind of exactly what we talked about, coming here to be a part of STS and other national societies that are able to really help continue to promote our education and how we're seen throughout the community, and work together with physicians and other multidisciplinary teams to really provide quality evidence-based practice and then taking it back to our institutions. Exactly. Jill, do you have anything else that you'd like to add on that as far as the ideal world, how you really support your program?
One other thing on professional development, you made me think of this sitting here. We often go forward and we ask for new staff, and sometimes you only need one. So there are great opportunities to look at how do you cross-train and build a little bit of depth and a little bit of strength and some bench on the team. And we've had really good success in cross-training people to step into other roles, to back people up. And actually, as people then start to move around in the system and they look for new opportunities, they tend to stay in the service line and they may take a different role. So that has been a really great opportunity for us as we've looked at, as the teams got larger, but we had subspecialties that may have fewer team members. It's really been a really tremendous opportunity for professional growth and also programmatic growth. And I think it makes them better providers. So I think that's been one of the lessons learned, probably just in the past few years. I don't know if that's something you guys are doing, but that's been received very well.
Great.
So.
Well, I just want to thank everyone for watching this portion of CTSNet. What an honor it's been to be able to discuss advanced practice together with leaders across the nation, building programs so that we can continue to support each other. And for those others who might be across the nation that aren't able to come to be a part of STS, that we have another forum like this where they're able to be engaged and hear these critical conversations and be able to help to support their programs with advanced practice. So thank you very much.